Welcome to Calm Mind and Healthy Body, our channel. Understanding the link between heart disease, excess weight, diabetes, heart failure, obesity, Wegovy, overweight, and cardiovascular disease. In today's fast-paced world, it's crucial to recognize the intricate connection between heart disease, excess weight, diabetes, heart failure, obesity, Wegovy, overweight, and cardiovascular disease. These health conditions are not isolated. They often intertwine and exacerbate one another, leading to severe implications for overall health and well-being. The prevalence of these health conditions in today's society is staggering. Heart disease remains the leading cause of death globally, with excess weight and obesity being significant risk factors for its development. Diabetes, both type 1 and type 2, further complicates the picture, as it can lead to cardiovascular complications and heart failure if not managed effectively. Heart failure, a condition where the heart is unable to pump blood efficiently, is a growing concern, especially among individuals with obesity and diabetes. The burden of these conditions is further compounded by the rising rates of overweight individuals who are at an increased risk of developing cardiovascular disease. One promising development in the fight against obesity and its associated health risks is the introduction of Wegovy, a novel medication that has shown significant efficacy in promoting weight loss. Wegovy can reduce the risk of developing heart disease and other related conditions by addressing excess weight. The impact of these health conditions on overall health and well-being cannot be overstated. Excess weight and obesity not only affect physical health but also have profound implications for mental and emotional well-being. Individuals struggling with these conditions often face stigma and discrimination, which can further exacerbate their health outcomes. Before we dive deep into the main subject, if you enjoy our content, we'd appreciate it if you could subscribe and hit the notification bell. Hence, you'll be updated on health tips, recipes, and wellness inspiration. I appreciate your support. Diabetes, heart failure, and cardiovascular disease can significantly impact quality of life, leading to reduced mobility, increased healthcare costs, and a higher risk of premature death. Individuals can improve their health and well-being by understanding the link between these conditions and taking proactive steps to address them. In the following sections, we will explore the connections between heart disease, excess weight, diabetes, heart failure, obesity, Wegovy, overweight, and cardiovascular disease, exploring the latest research and treatment options available to help individuals lead healthier, happier lives. Stay tuned to learn more about how you can take control of your health and reduce your risk of these severe health conditions. Understanding heart disease. Exploring the relationship between heart disease and excess weight, diabetes, heart failure, and obesity. Heart disease, also known as cardiovascular disease, encompasses various conditions affecting the heart and blood vessels. It is a leading cause of morbidity and mortality worldwide, making it essential to understand the multiple factors that contribute to its development, including excess weight, diabetes, heart failure, and obesity. There are several types of heart disease, including coronary artery disease, heart failure, arrhythmias, and heart valve problems. Each type has its unique characteristics and risk factors, but they all share the common feature of affecting the heart's ability to function correctly and pump blood efficiently. Excess weight, diabetes, and obesity are significant contributors to the development of heart disease. Excess weight, particularly around the abdomen, can lead to an increase in cholesterol levels, high blood pressure, and insulin resistance, all of which are risk factors for heart disease. Diabetes, both type 1 and type 2, is closely linked to heart disease, as high blood sugar levels can damage blood vessels and increase the risk of heart attacks and strokes. Obesity, defined as having a body mass index (BMI) of 30 or higher, is a significant risk factor for heart disease. Excess body fat, especially visceral fat around the abdomen, can lead to inflammation, insulin resistance, and dyslipidemia, all of which contribute to the development of atherosclerosis and other cardiovascular complications. The risk factors associated with heart disease are numerous and varied. Some of the most common risk factors include high blood pressure, high cholesterol, smoking, physical inactivity, poor diet, and a family history of heart disease. Individuals with multiple risk factors are at a significantly higher risk of developing heart disease and should take proactive steps to manage their health. By understanding the relationship between heart disease and excess weight, diabetes, heart failure, and obesity, individuals can take steps to reduce their risk and improve their heart health. Lifestyle changes such as maintaining a healthy weight, exercising regularly, eating a balanced diet, managing stress, and quitting smoking can all help prevent or manage heart disease. In the next section, we will explore the latest research and treatment options available for individuals at risk of heart disease, providing valuable insights into how to protect and optimize heart health for a longer, healthier life. Stay tuned to learn more about controlling your heart health and reducing your risk of heart disease. Heart failure and cardiovascular disease. Understanding the impact of obesity and overweight. Heart failure and cardiovascular disease are severe conditions that can have devastating effects on overall health and well-being, particularly when compounded by obesity and being overweight. It is crucial to delve into the specifics of these conditions and their relationship to excess weight to understand better how to prevent and manage them effectively. Heart failure is a chronic condition in which the heart is unable to pump blood efficiently to meet the body's needs. It can result from various underlying causes, such as coronary artery disease, high blood pressure, diabetes, and obesity. Unlike a heart attack, which is a sudden event caused by a blockage in the coronary arteries, heart failure develops gradually over time. It can have long-term implications for heart function. Obesity and being overweight have a significant impact on heart health and can increase the risk of developing heart failure and other cardiovascular diseases. Excess body fat, especially visceral fat around the abdomen, can lead to inflammation, insulin resistance, and dyslipidemia, all of which contribute to the development of atherosclerosis and heart failure. Additionally, obesity is associated with an increased risk of high blood pressure, diabetes, and sleep apnea, all of which are risk factors for heart disease. Managing cardiovascular disease risk factors is essential for preventing heart failure and other heart-related conditions. This includes maintaining a healthy weight, exercising regularly, eating a balanced diet of fruits, vegetables, whole grains, and lean proteins, managing stress, quitting smoking, and monitoring blood pressure and cholesterol levels. By addressing these risk factors, individuals can reduce their risk of developing heart failure and improve their overall health. Regular checkups with healthcare providers are also crucial for monitoring heart health and identifying potential issues early on. Individuals with a family history of heart disease, diabetes, or obesity should be especially vigilant about managing their cardiovascular risk factors and seeking appropriate medical care when needed. In the next section, we will explore the latest advancements in treating and managing heart failure and cardiovascular disease, providing valuable insights into how individuals can take control of their heart health and reduce their risk of these severe conditions. Stay tuned to learn more about how you can protect and optimize your heart health for a longer, healthier life. Exploring Wegovy and its role in addressing obesity and its potential impact on heart health. Wegovy, a novel medication for weight management, has garnered significant attention for its potential to address obesity and its implications for heart health. By delving into how Wegovy works and its impact on weight reduction and heart disease prevention, we can better understand its role in promoting overall health and well-being. Introduced as a breakthrough medication for weight management, Wegovy, also known as semaglutide, belongs to a class of drugs called glucagon-like peptide-1 (GLP-1) receptor agonists. It mimics the effects of a naturally occurring hormone that regulates appetite and food intake, leading to reduced calorie consumption and increased feelings of fullness. Wegovy's mechanism of action helps individuals lose weight and has potential implications for preventing heart disease. Obesity is a significant risk factor for heart disease, as excess body fat can lead to inflammation, insulin resistance, and dyslipidemia, all of which contribute to the development of atherosclerosis and cardiovascular complications. Wegovy may help reduce these risk factors and improve heart health outcomes by promoting weight loss. The benefits of using Wegovy extend beyond weight reduction and heart disease prevention. Clinical trials have shown that Wegovy can lead to significant weight loss in individuals with obesity, with some patients achieving weight reductions of up to 15% or more. This weight loss can positively impact overall health, reducing the risk of developing obesity-related conditions such as diabetes, high blood pressure, and sleep apnea. However, there are considerations to keep in mind when using Wegovy. Like any medication, Wegovy may have side effects, including nausea, diarrhea, and a potential impact on the pancreas. It is essential for individuals considering Wegovy to consult with their healthcare provider to determine if it is the right treatment option for them and to monitor for any adverse reactions. In conclusion, Wegovy represents a promising advancement in treating obesity and its potential impact on heart health. By understanding how Wegovy works, its implications for weight reduction and heart disease prevention, and the benefits and considerations of its use, individuals can make informed decisions about their weight management and overall health goals. Stay tuned to learn more about the latest research and insights on Wegovy and its role in promoting healthier lifestyles. It is crucial to recognize the intricate connections between heart disease, excess weight, diabetes, heart failure, obesity, Wegovy, overweight, and cardiovascular disease to promote better heart health and overall well-being. By understanding how these conditions interplay and impact each other, individuals can take proactive steps to manage their health effectively and reduce their risk of developing severe cardiovascular complications. Individuals can significantly reduce their risk of heart disease by making conscious lifestyle choices, such as maintaining a healthy weight, staying physically active, eating a balanced diet, managing stress, and avoiding tobacco use. We urge viewers to seek further information and support for maintaining heart health, whether through discussions with healthcare providers, community health programs, or engagement with online resources and support groups. Remember, your heart health is in your hands. Take control today and prioritize your well-being. Together, we can work towards a heart-healthy future for all.